So now I'm just going to discuss the breast exam and how I would guide my client through physical assessment. One question that I would ask them is when is the best time to perform a breast exam? And the answer to that is after their period. I would have them look in the mirror and assess for symmetry. I would ask them if there's any inherent abnormalities that aren't new to them. I would look at the venous pattern on the breast and make sure they're same bilaterally. I would assess the skin, assess for any breakdown or lesions, including the areola and nipple area. At the nipples, I would assess if they point outward and if they've always pointed outward. I would have the client put their hands on their hips, and this changes the musculature in order to bring out any dimpling or puckering. Also, raising your hand over your arm does the same thing. Next thing I will do is I would have the patient lay on their back and I would place a pillow under them. And during the assessment, I would make sure they were comfortable. And what I would do is take 3 fingers and in a circular motion using my finger pads and not lifting up my fingers, I would assess the breast tissue in a circular motion all the way around to the nipple, assessing the areola, making sure there aren't any lesions or any nodules, and I would report any abnormal findings. I would squeeze the nipple in 2 directions and make sure there's no discharge. I would also have the client assess under their arm, because this is usually an area, a hidden area where there could be a nodule felt. So at this point in time, I'm going to have Anthony come back out, and I'm going to have him sit down. And what I'm going to have Anthony do is I'm going to look under your arm for any redness or swelling.
Okay.
And there isn't any. So next I'm going to feel for his central nodes. So these are his central nodes, and there is no non-palpable. Any pain?
No.
Okay. Next I'm going to feel for his lateral nodes. Non-palpable, any pain?
No.
Okay. Next your pectoral nodes. And I just want to ask you if you're having any pain at that site as well.
No, I'm not.
All right, I'm going to have you lean forward. Your subscapular nodes are back here. I'm just going to feel back here. And they are non-palpable. Any pain?
No.
No redness or swelling. Internal mammary nodes line the sternum here. And then you have your epitrochlear nodes, which are in the inner aspect of your elbow. And is there any pain?
No.
Okay. All right, perfect.